everyone. Thank you so much for attending. I am sure there is nothing you'd rather be doing in your time off than attending a Medicare seminar, but I promise I will make this as interesting as possible, and hopefully you'll learn a lot through it and you'll have a little bit of fun too. So, my name is Tabitha Justice. I am the owner of Just Us Retirement Solutions, and I am going to be the one to walk you through the basics of Medicare this evening. I don't know if any of you have ever attended a Medicare seminar webinar before, but I think this will be exciting for you. So, just before we get started, I want to tell you just a little bit about me so that you understand where I'm coming from and why I talk about Medicare the way that I do. So I started Just Us Retirement after spending a year in the Medicare insurance space. And what I noticed was a lot of people were falling through the gaps. They either were not getting on the right plan or they weren't making the right decisions. And I found out it was often because they didn't have the information they needed, or they felt overwhelmed by the process, or they just didn't know who they could trust for information. And so that's why I started Just Us Retirement. We are a very, very education and collaborative focused insurance company. So, what that means is we don't focus just on someone's insurance plan. We try to cover all the gaps in information and in care that you're going to need as you age, or perhaps you're going to need for your parents. We try to combine everything into one spot for information so that you know what's coming ahead, you know how to plan for it, and you don't have to quickly make decisions, but rather you know in advance and can prepare properly. We partner actually with over 40 different organizations across West Virginia in order to help complete our mission of being a collaborative and help and education focused company. So, if you do want to work with us as we go through this, we actually have 4 locations currently. We have Charleston, Tays Valley, Point Pleasant, and Parkersburg. We are opening one in the Canova area, and we can do in-person appointments at any of our locations. For special occasions, we can do in-home appointments, and often people feel more comfortable meeting at like a local coffee shop or a library, and we do that also. We can also do virtual appointments over Zoom or Teams, and then we do phone appointments. You can always reach us at hello@justusretirement, 681-340-1377. So I'm assuming that you're watching this because you're getting ready to go into Medicare or you have Medicare questions. So I just want to give you a couple quick tips about how you can kind of scope out who you're talking to, who you're working with, because of course we're not the only company that does this. There is nothing wrong with doing a little bit of cyber stalking. If someone is talking to you or a company is reaching out to you, you should look them up. You should search out their social media, see the name of the company they work for, look at their engagement post. Is it someone who has a lot of friends? Is it someone that doesn't engage a lot? Is it someone who has a lot of negative energy about them? I think those things are really important and kind of helps you understand whether this is a person or a company that you want to work with. Google reviews is another great way of kind of getting an idea of who it is you're talking to. If you look at someone and they have a whole bunch of 1 and 2 star reviews, that's going to tell you a lot. We actually have a 4-point star rating right now. We lost 1 star for someone because he says he wishes he had met us 10 years ago. So it's not a bad reason to lose 1 star, I guess. You should also, if you're going to work with someone or a company, you should absolutely look up their social media presence. You can find us on Facebook at Just Us Retirement. And then we also have on Facebook a private Medicare group that all of you are welcome to go to. It is WV Medicare Questions. I am the one that lets everyone in, so you can't get in without my approval. So it's a safe place to where you can go, you can ask questions, and we post tons of information in there. Last thing I want to go over, because this always comes up, so I just want to address it right away. What exactly does an agent do? Do you even need us? So our role as an agent is to help educate you on all the options that are available, to help you think about the things that maybe you had not thought about, and then to make sure that when you have questions, you call us. You don't need to call the carrier. We help walk you through it. If you have billing issues, if you're wanting to see a new doctor and you're not sure they're a network, these are all the things that an agent can do. And we also know, despite what maybe an insurance company says they'll do, we can tell you more. This is how it really works. This is who you can trust. Maybe this is who you should steer away from a little bit. That is our role as an agent. How much does it cost to use an agent or an agency? This often surprises people, and I'm going to tell you the answer, and then I'm going to explain why. So truthfully, it doesn't cost anything to use us at all. The insurance companies that you're going to be signing up with for your Medicare plan want you to be happy on their plan. They don't want you to be upset, complaining to your friends, doing bad social media posts. And so they actually pay us for the time that we spend with you guys, to make sure that you're getting the help that you need and that you're happy on your plan. So if you use us, the premiums are exactly the same as if you would do it on your own. There's no price difference. It doesn't cost you anything to use an agency. So there's no downside to it. There's just lots of plus sides, because we know all the ins and outs of the plans and mistakes that people make. And you're just able to use the expertise that we provide at no additional cost to you. And the last thing I want to talk about are there other companies that do this? Absolutely, 100%. We are not the only company. I think we're the best company, but we are not the only company. So as you're looking through this to see who to work with, there's a couple of things you should know. There's a really big difference between working with a local company and a national company. A national company is bigger, but it's really hard to know the networks and the certain local programs that are available, the local doctors. It really makes such a difference when you have that local touch, especially when you're in a small area like us in West Virginia. And then there's another thing you should know: captive versus broker. A captive agent means they work for an insurance company. So they are only allowed to talk about what their insurance company, what that company provides. That's what they're trained on. And they have a legal obligation to the company that they work for. What my agents and myself are is we're a broker. So a broker means that you are licensed with as many companies as you're able to license with or choose to license with, so you can train on what you want to train and learn what you want to learn and talk about whatever it is that you think best suits your client, because our legal obligation is to a client, not to a company. So I think those are really important things that people need to know. So now that we have kind of got past just the basic information, what you should know as you head into this journey, we're now going to talk about Medicare. So this chart is what most people see when they look at Medicare. I have always felt like this doesn't fully explain the Medicare options, so I'm going to do mine a little bit different tonight. We're going to call this ain't your mama's Medicare. I'm from Mingo County, West Virginia, and we say mama down in Mingo County. So that's what we're going with. The reason I call it this is I think a lot of people don't always realize all of the changes that have been made to Medicare since it first started. And those changes are really important to understand. A lot of times you'll hear in the news, Medicare doesn't cover what it used to, or Medicare isn't what my grandparents had. And sometimes that's true. Sometimes it's also Medicare has gone back to what it originally was meant to do. But all of those little things are incredibly important to understand because what you think of as Medicare may not be how it is in its current implementation. So we're going to go through the history of Medicare, how Medicare is today, and then how it's going to affect you. Because I think one thing that people don't always realize is, for instance, if you had to guess, what would you guess the average life expectancy of a man was when Medicare first came out in the 1960s? It was 65. And Social Security. When Social Security first came out in the 1930s, the average life expectancy was 62. So let's think about that for just a second. If the average life expectancy when Medicare first came out was 65, and when you start Medicare, it's 65, and when Social Security first came out, the average life expectancy was 62, and you can start Medicare or Social Security at its earliest at 62. It's almost like there's a pattern there, right? This is important because we have this idea in our mind that Medicare was built to be an amazing program that was going to carry us far into life, into our 90s and 100s potentially. And the facts tell us a very different story. These programs were not built to carry us far into old age. And that is incredibly important because we are living much longer. We're on much more expensive medications. We are going to nursing homes, which is something that never happened before. So we have to think about our journey into Medicare completely different than previous generations did. And that's what we're going to go over today. So this is the chart that we're going to use. I feel like it's a lot more interactive. Imagine each of these blue boxes as an insurance card. It's the easiest way to think about this. We're going to start with the top card right here. And this is going to be your red, white, and blue card, just your original Medicare card. So it is made up of two parts. You have original Medicare Part A, which is your hospitalization. For most people, you don't pay anything for Part A because you have paid for that with your FICA taxes over the year. So Part A is your inpatient hospital care. Part B is your physician services, certain medications that you take while you're either in your doctor's office or you're in the hospital, and then durable medical equipment. These are things like hospital beds, wheelchairs, things like that. For most people, the cost for that is $174.70 currently. I say for most people because a lot of people don't realize this, but your Part B premium is 100% based on your income. Most people fall within a tax subsidy to where it's $174, but at your lowest income, it can be $0, and at your highest income, it could be close to $600 a month. So this is something that you really have to be careful on. Don't just assume it's going to be $174. You really want to get that checked out beforehand to see where you're going to fall. All right, so back to the chart. We have original Medicare card, Part A and Part B, and it is considered a national plan. What that means is if you have Medicare, you are able to go anywhere you want in the United States, and for the most part, as long as that facility that you choose or the doctor that you choose accepts Medicare, then you are going to be able to get in without prior approval and without a referral. So prior approval means that if your doctor orders something for you and it is something that is considered medically necessary and it's something that Medicare pays for, no prior approval means that for the most part, Medicare is going to approve it. Prior approval means your insurance company has to approve it. In this case, with original Medicare, there is no prior approval other than Medicare itself. Medicare is also considered to be an 80-20 plan. Now, this is not completely accurate, but we're going to go with this because it's the easiest way of thinking about it. So what that means is Medicare is going to pay 80%, and then you are responsible for the remaining 20%. 20% of a doctor's visit is probably not that big of a deal. 20% of $1 million surgery is probably a pretty big deal because there's no cap on that. 20% is 20%. Also, when Medicare first came out, there were only two options. You either had Medicare by itself or you had Medicare and employee coverage. And those were the only two options for about 18 years. Then Medicare came out with the second card. The second card goes by two different names. Some people call it a Medigap. Some people call it Medicare Supplement. Means same thing. I'm going to call it a Medigap just because that's easier to say over and over again. The easiest way of thinking about a Medigap plan is to think of it like a puzzle piece, all right? They are made to go together. So imagine that my hand here, is the 80% that Medicare pays, and the space between my fingers is the 20% that you're supposed to pay, okay? So if this is the Medicare supplement or the Medigap plan, it's going to come in and pick up that 20% just like that. So because it has to be a puzzle piece, if Medicare is a national plan, then the Medigap must also be a national plan. And there are 13 different Medigap plans that are available. So there's 13 plans, but there's hundreds of companies that sell these plans. So if you try to research this on your own, this is something really difficult for you to research on your own, but you'll notice the price differences between these 13 plans vary greatly, which is odd in a way because the government mandates what has to be covered by these plans. So medically, they cover the exact same thing if their particular drug plan or Medigap plan. So if they medically cover the same thing, why is there a huge price difference between them? So some of them cover the 20% slightly different. Some of them cover deductibles slightly different. And some of the companies don't allow you to have an agent. They say if you have questions, you have to personally call in yourself. Some of them will allow you to have an agent. And so the agent can call in and ask questions and get reviews on your behalf. Some of the companies are also very, very notorious for getting you in to their plan and then jacking the price up incredibly high. And on the Medigap plans, once you're past your 65th birthday, you have to health qualify to switch plans. So they're kind of hoping that you'll get on their plan and then you can't switch off of it because you're not healthy enough to switch off of it. From your point of view, it's very hard to see that, but we as agents have a little bit more data and experience. We're able to kind of tell you which ones to go with and which ones not to go with. So 2005 is when they added the third card on, and this is when Medicare really started getting more complicated. This third card is called Part D. Think of Part D for prescription drug coverage. This is the first time Medicare went from a national plan to a county plan. The county that you live in is what determines what your Part D options are. So if you live in a southern county, up north may be totally different. If you live in a border county, what's across the river may be completely different options than what you have. This is also when Medicare first started bringing in restrictions. They added two words. They added networks and they added formularies. So networks mean only certain pharmacies are covered under certain cards. So as an example, there was a guy that I knew. I helped him. When he first started Medicare, he was not one of my clients. When he first started Medicare, he thought, this is easy. I can do this on my own. He went to the pharmacy to pick up his medications. He picked the drug plan, and then his medications were very expensive, hundreds of dollars. And he was like, oh my God, Medicare is really expensive, but he paid it. And then he kept paying it for years. What the pharmacy never told him was, hey, we're not in network with your card. It would be a lot cheaper if you went, next door to someone that's in network. So he spent thousands of dollars towards medications that were really not that expensive. Formularies is another example. So there's another restriction that they added on. Formularies mean only certain medications are covered under certain cards. So think about this. They have classes of drugs. A class of drug is used to treat a particular disease. We'll start there. So let's say that there are 40 different medications in this class of drugs. By law, these Part D plans are only required to cover 3 of the made up 40 different medications. So in this case, one of the medications that is on the formulary may be very affordable. But if you pick another drug that does the same thing, it may be incredibly expensive because it's not on the formulary. You may also have to pick maybe a generic instead of a name brand, a different tier of medications. But these are where the restrictions started coming in to where you had to be more careful what you picked. It wasn't just that everything is covered type of situation. Also, on average, when people pick a Part D plan, most people have 45 different Part D options that they can pick from. So out of that 45, they have to find ones that cover their medications and covers the pharmacy that they want to go to. So this side of Medicare is what is considered the original path to Medicare. This side can sometimes be considered more expensive, but this side also is considered to have more freedom. You don't have networks. You can go where you need to go. But this side also, you have to health qualify outside of when you first go on to Medicare. You have to health qualify to get a Medigap. And that Medigap plan goes up in cost every single year. And this side also doesn't have things like vision, dental, any of the extra benefits that people have become used to getting. So 2005 is when they also came out with this other side to Medicare. We're going to use a little bit of government math here. So if we take this Part A, and then we take Part B, and then we take Part D, and we bundle that all together, and we put it in one card instead of in separate cards, according to government math, what would A plus B plus D equals? According to the government, that equals C, Medicare Part C, or what is more commonly referred to as Medicare Advantage. So Medicare Advantage is a private alternative to Medicare. You still have Medicare. It is just not ran by the government. It is ran by a private insurance company, and they manage your Medicare for you. Let me explain how that works. So if you have Medicare Advantage, you still continue paying your Part B premium. And instead of that money going to the government, that money instead is sent over to the private insurance company. And then some of these Medicare Advantage plans have a monthly premium. Some of them do not. Some of them are $0. If you're on one that has a monthly premium, then you pay it, and it also goes to the private insurance company. And then the government sets aside a certain amount of money for you every month. It's based on your health. The more unhealthy you are, the more money that gets sent to the government or gets sent from the government. And that money also goes to the private insurance company. And then that company manages your Medicare benefits for you. Again, you still have Medicare. It is just in this situation, it is not managed by the government. So these plans are also based off of the county that you live in. These are also not national plans. And they are based on networks. The two most popular networks are called an HMO and a PPO. HMO. HMO is what's called a health maintenance organization. So let me draw this out a little bit different. So for an HMO, imagine this circle here is your network. This inside is all the doctors and all the different hospitals that plan has contracted with. As long as you stay within that circle, your network, then you're going to have co-insurance and co-payments that are laid out within your plan agreement. However, let's say you to a doctor over here and maybe a hospital over here, and they are not in your plan agreement. They are out of network. In that case, you are 100% responsible for the cost. Medicare is not going to pay, and your insurance company is not going to pay. PPO is what's called a preferred provider organization. So for that one, let's kind of do the same thing. You have all your doctors in network that has agreed to participate in your plan. As long as you stay in network, you have co-pays and co-insurance. If you go outside of network, for a PPO, you may or may not, but you likely will pay more for that. You just have a higher copay and you have a higher co-insurance. There are some plans that don't charge differently in and out of network, but that is not very common. So these plans, like I said, they're based on networks, and then they have co-payments and co-insurance. which is very different than Medicare's 80/20 plan. Because on the Medicare side, it's just a straight percentage. There's no copays. But on the Medicare Advantage side, it's more copay. You pay a copay when you go to the doctor. You pay a copay when you see a specialist. You have a copay when you spend the night in the hospital. It's what a lot of people are used to how your employee coverage works. It's a very similar concept. These sides also often have additional benefits. They're trying to increase your health, not just provide care. So they offer extra things like vision, dental, hearing. They'll offer over the counter stuff like vitamins or toothpaste, just different things to help keep you healthy that are outside of traditional health insurance. And then they'll give you gym memberships. Additionally, into this, again, they have the concept that they want to keep you healthy or healthier. So they'll call and remind you about doctor's appointments. They'll even drive, some of them will even drive you to doctor's appointments. Some of them will even come to your house and do the doctor's appointment in your house. It's not required that you do any of those things in your home, but that is something that they often offer. So if you go back, I meant to show something. So if we take when Medicare first came out and we had 2 options, and then when Medigap's came out, we added 13 more options. So now we're at 15 options. That's still manageable. And then Part D came out, and now we're at 70 options. And then Part C came out. Now we're at over 100 options to choose from. Do you feel a little bit better about being confused? I think this is where people really need to be easy on themselves. They have this idea in their mind, well, my mom didn't need help. My grandma didn't need help. Why do I need help? Well, mom and grandma didn't have over 100 options. That doesn't include options with employee coverage, veteran benefits, federal benefits, state benefits. There are so many different programs that are out there. It's often overwhelming for people. So have a little bit of grace with yourself. Understand it really is more complicated than your parents when they went onto this, or your grandparents, because this ain't your mama's Medicare anymore. Remember, it's massively changed. So this is kind of the part where people often ask me, what side is the better side? I'm going to be completely honest with you here. There's not one. For some people, the Medigap plan is far, far better. For other people, the Part C plan is far, far better. There's honestly not a perfect plan that works for everyone. There is a plan that works good for you and for your family and your lifestyle and your needs. So how do you figure it out? How do you decide? Well, first, let me say there's only one way of doing this that's really a bad way of doing it. And it's probably the way that all of you have already tried to do it. The worst thing that you can do is you're going to ask your friend, so what plan did you pick? Your coworker, what did you pick? And maybe your neighbor, ask them what they picked. As I've emphasized throughout this, Medicare varies a lot. So unless you have the exact same income, you live in the exact same county with the same medications and the same doctors and the same hospitals and all the same pharmacies and all the same sicknesses, why do you care how someone else's plan worked? Because it's going to work totally different than yours. And I know that sounds crazy, but it's true. Even spouses often get on very different plans because they have different doctors, they have different sicknesses. You can't base a plan how it works based off of someone else. And out of these 45 different options and 45 different options here and 13 different options here, that's a lot of different companies. And some of these companies maybe offer 7, 12 different plans under the same brand. Some brands or some of those plans are really good, some of them not so good. So just because someone said this brand is good, is it the right plan for you? So what we like to do from this point is we like to take all this information and then we set you down and we plug in your income. We plug in your medications. We plug in your doctors, your zip codes, your pharmacies. And then we give you, around 2 options over here. We're going to give you 3 options over here. And we're going to ask you what's important to you. Do you travel? Do you have a safety net in? I just recently worked with a couple and the husband went on the Medigap side and the wife went on the Medicare Advantage side. And if you ask him, he will say, I went Medigap because ain't no one going to tell me what I'm going to do with my health care. His wife went on the Medicare Advantage and she said, I've been a nurse my whole life. I know how the system works and I don't want to pay anything more than I have to for my health insurance. And they're both right. You get to pick the plan that works for you. So when we ask you what your goals are, what you're looking for, we take all of that into account. And then we suggest what we think will solve that. But then we ask you, now you have these ideas, go home, think about it. Don't rush into this. Spend one night thinking, what if I did this? Spend the next night thinking, what if I did this? Kind of feel how you feel about it. And I don't know about you guys, but when I go to the doctor, I usually have my list of, 12 different things I want to talk about. And I go to the doctor and then I get in my car and I'm like, I didn't remember to ask him any of those questions. It's a lot like that for health insurance. So once you sit down for your appointment, we strongly suggest you go home and you think about it and you write down questions and then you come back and ask those questions. And you do that as many times as you need to do it until you feel comfortable that you have reached the right answer for you. Don't let people rush you into this or feel like you're a burden by asking questions. This is your healthcare. You should have a right to take time and have it explained to you properly. I just realized I haven't popped this up yet, but I am now popping up how you guys can get a hold of us if you do want to sit down and make an appointment. This will just set you up with a complimentary 15-minute call so we can find out how you want to meet. Do you want to meet in person? Which office? Zoom? There's no pressure. One thing that you will really learn about us is we are very education. As many questions as you have, we're going to handle it and we're not going to rush you into anything. So now that we have gone over this, and again, a reminder of how we work, where you can get an appointment, and you can always email us or call us. I want to go over what is and what is not covered by Medicare. Long-term care. Long-term care is not covered by Medicare. Long-term care is not just nursing home. This is if you can't feed yourself, you can't bathe yourself, you're getting dementia. Medicare does not cover this. Dental care. Medicare does not cover dental care. Most Medicare Advantage plans do. Eye exams related to prescribing glasses, unless you're diabetic, Medicare does not cover eye exams. Dentures, most Medicare Advantage plans do. Dentures Medicare does not cover dentures. Some, but not very many, Medicare Advantage plans do. Cosmetic surgery, Medicare does not cover it, and Medicare Advantage does not cover it. Hope you have a sugar daddy, sugar mama. Acupuncture, Medicare does not cover acupuncture. Some, but not very many, Medicare Advantage plans do. Hearing aids, Medicare does not cover them, but they are available over the counter now. Most Medicare Advantage plans do cover them with a copay. Routine foot care, this is things like ingrown toenails, warts. Medicare doesn't cover that really. Most Medicare Advantage plans do. International travel, Medicare does not cover international travel. And international travel insurance is incredibly inexpensive. You can get $1 million policy with no out of pocket for around $75. You can get an entire year's worth of international travel for around $300. There's no reason to not get international travel if you're going out of the country. I also want to kind of quickly go over scams to avoid, and then we're going to be pretty much finished after that. I just want to remind all of you guys there's a Q&A section up at the top. You're welcome to ask me any questions that you have as we go through this. Just type them in and I can see them. I see a few. I'm going to get to them in just a second. So scams to avoid. Okay. When you first go onto Medicare at 65, so on your 65th birthday, if you have already been receiving Social Security for at least 5 months, then you are automatically enrolled into Medicare. If you have not been receiving Social Security for 5 months, then you have to apply for Medicare. You also need to apply for any secondary coverage that you would have, any type of drug plans, Medicare Advantage, Medigap. You get the picture. So scammers are very aware of this. And so something that they will do is they will call you and they will say, hey, we just need a little bit more information to finish up your application, because they know a lot of people, as they're approaching their 65th birthday, have just put in an application. And some people will be like, oh, I did just put in an application. Okay. And before they know it, they have verified their Social Security number, their banking account information, their Medicare ID. This is one of those scams that you are probably watching this and being like, I would never fall for that. And then people fall for it every day. Why? Scammers are really good. It's their only job is to scam people. So you need to be really, really careful about who you're talking to. Don't give your information out over the phone unless you really know who you're talking to. All of you have probably also received either in the mail or saw on Facebook the claim your Social Security, grocery benefits, or whatever they're calling it this month. Is that a scam? Kind of, sort of, maybe. So do these programs exist? Yeah, in a way. There are certain programs that do allow you to do things like grocery shop. However, the way that they phrase it is really misleading. Plus, it's 100% based on income. I will say this, though. For these programs, no one is really going out of their way to let you know about these programs. It's usually more they're looking for your personal information so that they can either sell you something or sell your information to someone else. So again, you want to be really careful about what you're filling out, what you're responding to. If you're working with a local agency, this is a huge benefit, because when you get those things in the mail, you can just take a screenshot of it and text it over to us. You can stop by the office. You can say like, hey, so-and-so said I could get this for you. A good agency has all of those programs available. So we can say, like, you don't qualify for this, which is why I didn't tell you about it. Or you can say, actually, you do qualify for this now. You didn't at the time. Let's sign you up for it. So that's another, again, a really good benefit of working with someone that you can trust. How many of you guys are getting the phone calls from Medicare? So I'm going to really emphasize this. Medicare will never, ever, 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 ever call you. Medicare does not call you. Social Security may call you, but they almost always send you a letter first, and they give you the exact date and time that they are going to call you. So if someone says they're calling on behalf of Medicare, you're welcome to scream in their ears as loud as you can because they're lying to you. Medicare doesn't call you. And again, Social Security may call you. If you didn't get a letter first, I don't know. I would be really careful about that. Again, just this is where a local agency can come and come to help you, because a local agency that's good is going to be able to do pretty much everything on the application process and verification that Social Security can do, and allows you to see face to face who you're working with. So the last one, again, kind of goes back to scams and spoofing. So people will call you and they will claim to be from your insurance company to get information out of you. Will your insurance company call you? Likely, they will call you. So you should feel comfortable expecting a call from you. Is your local or is your insurance company going to call you and ask for your Medicare ID or your banking information or ask you to pay for something? No. That's where, again, you have to be really, really careful. They're often scamming you. And if you don't know if you should trust them, just don't trust them. Hang up and call the main number of your insurance company and say, like, hey, so and or someone just called me. I want to verify, is this real or not? And again, you can also, if you're working with an agency, you can call the agency, you can screenshot it, and we can look into it for you. Another really good tip is you can Google the phone number. And if the phone number comes up and it says like call center or scam likely, you probably don't want to talk to them. But if it's like, this is the call center of such and such company, and that is your insurance company, it's more likely you can trust them and talk to them about it. But again, a local agency can help you with all of that. So that is pretty much everything on Medicare. I'm going to show you just a few more things. I hope that was entertaining and not as boring as you probably thought a Medicare presentation was going to be. I do have a couple questions that I'm going to answer, and then I'm going to show you a short little video. It's a 2-minute long video. Some of the questions that are in here: if I'm still working, do I need to sign up for Medicare? Maybe, maybe not. This is not a cut and dry issue. So if you have credible coverage through your employer and you have more than 20 people working for you, you don't have to sign up for Medicare. However, you should never use that as a blanket statement. It might be best for you to sign up for Medicare. It might be best for you to reject Medicare. Again, don't try to figure this out on your own. Bring your employee coverage in, meet with an agent, and then say, can you review this? And then let us say, like, this is what it will look like if you go on Medicare. This is what it will look like if you stay on employee coverage. This is what it will look like if you do Medicare and employee coverage. We're very well known for being honest with people and guiding them through that process. Someone else had a question of how soon should I meet? That's really up to you. I always say the sooner the better. You don't want to rush. or to wait last minute. We are a very, very education focused company. So if you come to us and you say, I don't know what I don't know, kind of set me up with everyone. We have estate planners that work here. We have attorneys here. We have financial planners here. We have long-term care specialists. If you want as much information as possible, I say come as soon as possible. Other people will say, I've already done my research. I just want verification that I'm doing the right thing. And those people will often wait until about 3 months before their 65th birthday, and they will come in and they say, I just want to know about this decision. And that's your choice. And we totally respect it and just answer that one question. I think those were the only 2 questions that we had. I'm going to play a short little video to show you a little bit about what we do, give you a little bit more of an idea about us. Again, you can schedule an appointment with us at any point. You can email us at hello@justusretirement.com. Call us at 681-340-1377. Follow us on Facebook or join our Facebook group, WV Medicare Questions. And my video is not showing. I don't get to show the video tonight. Well, thank you guys so much for attending. Again, I hope you really learned something. I'm going to go back here to, here's how you can work with us. I'm going to be here for the next 30 seconds to a minute to see if anyone else has a question. And I hope you had a good night. Thank you guys very much.